I'm getting ready for my Medicare and a supplemental provider this coming February. The only Medigap provider in my zip code is United Healthcare. In my research, I've read only negative reviews of this company and am surprised AARP partners with them. Does low customer satisfaction matter when a provider is contracted for Medicare supplements? Are they required by law to pay all the gap expenses?
That's a very good question. I hope everyone can listen to me here. Let's assume that you're correct that AARP's United Healthcare products the only one available in your area. I'd look around and make sure of that, because I don't know many areas where they're the only ones available. They might be the only ones that are competitive in some areas. Some might be overpriced, but I think there are always other options. But your question is right. Honestly, with Medigap insurance, it's the one place where I say, almost you can't, the company doesn't matter. But you notice two differences when you change from one company to another. And that's the name on the card and the logo on the card in your wallet, and then the little line item on your bank draft that says where the premium came out of. That's the only difference you're going to have. All other systems are pretty much automated. And the other thing you have to understand, Medigap insurance is tightly controlled. It's a pretend little world where everything's the same, everything's right. When you get into that system, the company can't decide claim by claim, we're not going to worry about this or that or whatever. The only differences you'll find in company is often, the only difference you'll find in going into companies that you'll have to be wary of is some companies, and they're allowed to put a waiting period on pre-existing conditions up to 6 months. So if you have a pre-existing condition, you want to be mindful that may not be covered for the first 6 months, assuming it's your first time on Medicare supplement insurance or you didn't have credible coverage before. If you had credible coverage, then that waiting period can be satisfied by that previous credible coverage. And it makes sense to me, but insurance companies have to do that. So someone doesn't wait until they get cancer diagnosis and then get on the insurance coverage, right? So they put this in that you can do that. But if I already had a Medigap policy, or I already had employer-sponsored health or a major medical plan when I'm coming on to group insurance, well, of course I'm not buying it just because I just got a diagnosis. It's a continuity of care situation. So then those pre-existing conditions will be satisfied by your old plan. So that's really the one thing I look at as a difference, and each company does have some flexibility. Some have 0, some have up to 6 months, some 3 months. Look at that to make sure, but once you have it, as long as the company doesn't go out of business, the claims paying ability and the way that they cover you will be exactly uniform from one company to the other.